Welcome to the Explainer. Today, we are breaking down a truly critical class of cardiac medications, ARNIs. Now, if you're reviewing pharmacology or just brushing up on your bedside nursing care, you already know exactly how complex cardiovascular drugs can seem when you're staring at a textbook. But our goal today is to make this incredibly straightforward and honestly, pretty memorable. We're going to cover exactly what this drug does, what you absolutely have to watch out for, and how you ensure your patient stays safe. Okay, let's dive into this.
Here's our roadmap for today's Explainer. We'll start by introducing ARNIs and Entresto, break down their mechanism of action, look at the potential side effects, discuss the crucial nursing interventions, and finally wrap up with the signs of worsening heart failure.
Section 1. Introducing ARNIs and Entresto.
So the acronym ARNI actually stands for Angiotensin Receptor-Neprilysin Inhibitor. I know, it's a massive mouthful, right? But breaking it down makes it completely manageable. An ARNI is actually a combination drug. It contains two specific active medications mixed together, sacubitril and valsartan. Out in the real world, you're most commonly going to see this administered under the brand name Entresto. So, who actually needs this drug? Well, in the clinical setting, ARNIs are utilized specifically to treat patients who are suffering from heart failure that features a reduced ejection fraction. It's a highly targeted therapy for a very specific high-risk cardiac population.
Section 2. The mechanism of action. Let's look at this physiological chain reaction in 3 simple steps, and this brilliantly illustrates exactly what happens inside the patient's body. Step 1. The medication goes to work to inhibit angiotensin II and neprilysin. By blocking these, we trigger Step 2, which prevents the body from breaking down vital substances known as ANP and BNP, your natriuretic peptides. Whenever we successfully prevent the breakdown of these peptides, we achieve Step 3, our ultimate clinical goal, vasodilation and diuresis. Essentially, the drug is relaxing and opening up the patient's blood vessels, while simultaneously helping their kidneys flush out excess fluid. For a patient with heart failure, taking that fluid pressure off their overworked heart is exactly what they need.
Section 3. Potential side effects. Because of that exact mechanism of action we just learned about, that rapid vasodilation and diuresis, we naturally have side effects that can occur. Hypotension or low blood pressure makes perfect sense, right? We're artificially dilating vessels and pulling fluid out of the body, which can obviously also trigger dizziness for the patient. You also really need to watch for high potassium levels, renal insufficiency, and coughing. And finally, a severe and potentially life-threatening side effect to always monitor for is angioedema, which causes severe swelling. Memorizing this list is a lot easier when you connect it directly back to the fluid and vessel dynamics we just discussed.
Section 4. Crucial nursing interventions.
So, the crucial point is 36. As a nurse, you have a golden rule with this drug class. You do not ever administer an ARNI with an ACE inhibitor. In fact, you must ensure there is a massive 36-hour window before or after an ACE inhibitor has been given before you can safely administer an ARNI like Entresto. 36 hours. That is an absolute hard stop that requires your careful chart review before handing the patient that pill. Beyond that strict 36-hour rule, your daily monitoring has to be highly systematic. It splits really nicely between vital signs and labs or assessments. For vitals, because of that intense vasodilation risk we covered earlier, you must closely monitor the patient's blood pressure and heart rate. Then, over on the labs and assessments side, you need to draw and track their electrolytes, making sure to look out for that high potassium side effect. You also evaluate their renal function by specifically looking at the BUN and creatinine numbers. And because we're treating heart failure by manipulating fluid volume, you must continuously monitor their intake and output, assess their body for any visible swelling, and diligently record their daily weights. Tracking all of this is what ensures safe, effective administration.
Section 5. Signs of worsening heart failure. Now, I want to ask you directly, how would you know if the medication is failing? Let's say your patient is taking their prescribed dose of Entresto every single day, but heart failure is a notoriously stubborn condition. What exactly are the physical signs that tell you their condition is worsening despite the pharmacology?
Well, here are your severe red flags. When you listen to their lungs, are they developing crackles for the very first time, or are their existing crackles getting worse? Next, observe for a cough. As noted directly in the clinical literature, if the patient develops a productive cough, that is considered a super bad sign that warrants immediate intervention. Furthermore, you need to be on extremely high alert if they report chest pain, if they show sudden weight gain, which literally proves why those daily weight checks are so strictly required, or if they start experiencing difficulty breathing. Any of these signs indicate the fluid is building back up and the ARNI is just not keeping the heart failure at bay.
The pharmacology behind ARNIs, like Entresto, is scientifically brilliant. It manipulates enzymes and peptides to save failing hearts. But at the end of the day, attentive nursing is the ultimate safety net for heart failure patients. Your strict adherence to the 36-hour ACE inhibitor rule, your dedication to daily weights and lab draws, and your sharp ear catching a worsening productive cough, that careful monitoring is the crucial bridge between complex drug mechanics and a patient's actual survival. So how will you apply these safeguards the next time you assess a patient on an ARNI? Thanks so much for joining me for this explainer. I hope this brought everything into focus for you, and keep learning.